For years, Sonia Lemus would drag her daughters to an Alamo, Texas hospital whenever they got sick. As an illegal immigrant, she had no health insurance, and the only place she knew to go was the emergency room. She says the reasons for her hospital visits ranged from the flu to falls.
And in this country, there is access to care for everyone, but it's through the emergency room.
The Lemus family's options eventually improved with the expansion of community health clinics, which offered free or low-cost care. But President Barack Obama's healthcare overhaul threatens to roll back some of those services if clinics are overwhelmed with newly insured patients. Hospitals will also see cuts in payments from the federal government.
So that cost has to be absorbed by whatever hospital that happens to be. And that is really a big challenge for a lot of institutions. So
the health care law was never intended to help the country's 11 million undocumented residents. Instead, it was meant to give 32 million uninsured Americans access to coverage. Federal cuts are expected to be less severe in the 8 states, including Texas, that are home to 2/3 of the country's illegal immigrants. But that still doesn't mean they will have enough money to take care of patients.
It's hard to lose a little bit on everyone and make it up in volume, as they say.
As for Sonia Lemus, she says even if she does have to go back to slower treatment in the emergency room, she knows the staff will take care of her medical needs and help her fill out all of the paperwork to make sure the government covers the bills she can't afford. Carlotta Bradley, The Associated Press.